Good afternoon. For all three of you, San Leandro Hospital plays a special place in my heart. My father worked there. My mom is a 32-year nurse, registered nurse, still works there. How are each of you, what are your plans for saving San Leandro Hospital?
We'll start with Mr. Lowe.
Well, I'm glad you mentioned that. I had an uncle who passed away. He was just before he was 50, and he spent a lot of time at San Leandro Hospital. San Leandro Hospital, I think, covers somewhere in the neighborhood of about 20,000 people a year. And it's interesting to understand that someone would talk about closing a hospital when we're getting ready to put 30 million people who have no health insurance, 4 million people in California, and roughly 200,000 people in our county into hospitals now, into the medical process. I think that that's the most compelling argument we have right now. I mean, Alameda County's records show somewhere in the neighborhood of about 90,000 people who are not insured and they're not covered. But certainly, we have an ability to be able to talk to Summit and to talk, look, we have 30 million people who are going to be coming from the roles of the uninsured to the hospitals. So I'd like to be able to address that. I think that one of the things that you'll find from me is I really want to have top-to-top conversations and broaden the conversation. This isn't a matter of, you know, making sure that they can make a profit. And I think that we can talk to them in a way that makes sense to understand that you're going to have a lot more people coming to the table.
Thank you. Ms. Chan?
Well, as you probably know, the Board of Supervisors voted last year to make it into a rehab-only facility, and that's not satisfactory to the community. So I would work to change that plan. Right now, I think there are two viable options that I'm actually looking into, so I don't know which one we'll end up with. One would be if Sutter would release the lease and another provider would come in and buy it. So that's one option. The other option is for the county to continue the lease, but to do a hybrid model, where it would have 1 to 1.5 floors of rehab, but also retain the acute care beds and the ER. So I'm working with the unions, I'm working with folks in the community. I went down to the hospital, talked to some of the doctors. I've already started working on this. And I think we're going to have to see which one is going to be the most viable. But the main goal is this hospital has been here for 50 years. It serves 27,000 people in the emergency room. If it goes away, where are these people going to go? So I'm very, very committed to working. And I know the details. Actually, with Alameda Hospital, I helped write the plan for the hospital district in 2000, even after I left the board. And I saved Highland Hospital from closing as well. So I have a lot of hospital experience. And I will work, make this a very, very high priority, which I have already in my campaign.
Next question.
Okay.
Wait a minute. Did I miss you?
Yeah.
I'm
sorry. Okay, so this is a critical issue, not only for San Leandro, but for our entire region. And I think I mentioned earlier, Alameda Hospital was at risk of closing 8 years ago. And I helped lead the process to establish the hospital district and to do what we needed to do to keep Alameda Hospital open. And because the delivery of health care doesn't just affect the community where it is, but it affects every community around it. Now, I think we need to stop, and I've also been working on this issue. I think we need to stop the progress, you know, where we are now, just bring it to a screeching halt. We need to take time and really look at this, because Sutter says that that hospital is operating at a loss. We don't know that. Sutter is a large enough corporation. Through accounting techniques, they could assign more losses to San Leandro Hospital and assign more revenues to some other, just to make it look like San Leandro Hospital is doing worse than it really is. Now, I'm sure that it's not doing really well, because no hospital is. Alameda Hospital is also, you know, having to figure out a way to survive. But I believe that we need to stop this process now and develop a long-term strategic plan for development of for delivery of healthcare services throughout the county. And so that's what I would work on as supervisor.